Hello friend, this is me, your host. Welcome back to our channel. I hope you all are well and doing great. So today I'm back with another videos to give a review and talk about type 2 diabetes. If you guys have already watched my other videos on NHS that I made on some other diseases, then you will know that what we're going to see today in this video. So in the last videos about NHS, we talked about type 1 diabetes. So in this video we will talk about type 2 diabetes. Type 2 diabetes is when a hormone called insulin does not work properly or there is not enough of it. This causes the levels of glucose in your blood to become too high. It affects adults and sometimes children. So let's see what is type 2 diabetes. What is type 2 diabetes? Type 2 diabetes is a common condition where your body cannot make enough of a hormone called insulin, or the insulin it makes does not work properly. It does not work properly, insulin resistance. Insulin helps your body use glucose for energy. Without enough insulin, the level of glucose in your blood becomes too high. Type 2 diabetes is different to type 1 diabetes, which is caused by a problem with your immune system. Unlike type 1 diabetes and type 2 diabetes, unlike type 1 diabetes, type 2 diabetes may be prevented. You can manage type 2 diabetes with diet and exercise or medicines. Having high blood glucose levels, having high blood glucose levels can cause complications such as heart disease, kidney disease, stroke, or nerve problems. It may be possible that to prevent type 2 diabetes or stop it, remission by losing weight and improving your diet. Symptoms and diagnosis. Symptoms of type 2 diabetes and how it's diagnosed. Symptoms of type 2 diabetes. The most common symptoms of type 2 diabetes are feeling very tired, peeing more than usual, feeling thirsty all the time, losing weight without trying to. Other symptoms can include blurred vision, cuts or wounds, taking longer to heal, itching around your private areas, or you keep getting thrush. These symptoms are the same. These symptoms are the same for both adults and children. If you get symptoms, not everyone gets them. They may develop gradually. These symptoms can be similar to type 1 diabetes, but type 1 diabetes usually develops more quickly and is more common in younger people, which is more likely to get type 2 diabetes. Some people have a higher risk of developing type 2 diabetes. You may be more at risk if you are white and over 40 years old or over 25 years old and from a South Asian, Chinese, Black African, or Black Caribbean ethnic background. You are white and over 40 years old or over 25 years old and from a South Asian, Chinese, Black African, or Black Caribbean ethnic background. A parent or your brother or sister has it. You are overweight and not very physically active. You have a condition that increases your risk such as high blood pressure. Although type 2 diabetes is less common in children, ethnic background, weight, activity, And family history can also increase the risk. Although type 2 diabetes is less common in children, ethnic background, weight, activity, and family history can also increase the risk. See a GP if you think you or your child may have type 2 diabetes. You or your child have a higher risk of developing type 2 diabetes. Not everyone with type 2 diabetes have symptoms, so it's important to get checked out. Check your risk. Use diabetes UK's Know Your Risk tool to help you find out your risk and on get advice on next steps. Get a free NHS health check. Get a free NHS health check if you are between 40 and 74 years old and do not have an existing health condition. Ask your GP surgery or local pharmacy for a check. Get a free NHS health check if you are between 40 and 74 years old and do not have an existing health condition. Ask your GP surgery or local pharmacy for a check. This is an overall check that may tell you if you are at a higher risk of health problems such as diabetes. How type 2 diabetes is diagnosed. Type 2 diabetes is diagnosed with a blood test that checks how high your blood glucose levels are. The results usually take a few days. Tests will confirm if you have type 1 or type 2 diabetes. Get advice about what to ask your doctor or other healthcare professional. If you are told you have if you are told you have type 2 diabetes, it can feel overwhelming. You may feel anxious about how it will affect you, about how it will affect you. But there will be doctors, nurses, and other health professionals into diabetes care teams you can talk to. They will be able to help with any questions about treatments and what happens next. If you are diagnosed with pre-diabetes, pre-diabetes means pre-diabetes means that your blood glucose levels are higher than normal, but not high enough for you to be diagnosed with diabetes. This also means you will be at you will be at higher risk of getting diabetes in the future. Most people do not have symptoms of such as being more, feeling tired, and losing weight without trying. Talk to your care team about how eating more healthy, exercise, and other lifestyle changes can help prevent you getting type 2 diabetes. Treatment. Treatment for type 2 diabetes. Lifestyle changes to help with type 2 diabetes. If you have type 2 diabetes or have been told told that you may get it in the future, lifestyle changes can help prevent lower your blood glucose levels. This can help to manage diabetes and possibly avoid having to take medicine. Lifestyle changes can sometimes lower your blood glucose levels. to a normal level and stop diabetes. What you can do to make lifestyle changes. Do try to eat a healthy diet including food including fruit, vegetables, whole grain fruits such as wholemeal, bread and oats and pulses such as chickpeas and lentils. Do improve your diet slowly if you're finding it difficult. A small change every week can make it easier. Do talk to a GP or diabetes nurse if you are finding it hard to change your diet, as they may be able to find support in your local area. Try to spend at least 2.5 hours across the whole week either walking or doing another activity that leaves you out of breath. Try to lose weight. Try to lose weight if you have been told overweight. Stop smoking, having diabetes, increasing the harmful effects of smoking. Try to limit how much alcohol you drink. Have regular dental checkups to prevent gum disease. Don't. Do not eat too much processed food with lots of salt and sugar. This may include things like bacon, chips, cheese, sweets, and biscuits. Do not change to a very strict no calorie diet without talking to a health professional first. This type of diet may not be suitable if you are taking insulin or other diabetes medicine. Children with type 2 diabetes will be under will be under specialist care. Diabetic courses. Diabetes courses are recommended for everyone with type 2 diabetes. They are designed to give you the confidence and skills you need to manage diabetes. You should be offered a few free courses within a 1 year of being diagnosed. There are also online courses that you can do at your own pace. For example, healthy living for people with type 2 diabetes, a free online course for people aged 18 and whoever live in the UK or carers of someone living with type 2 diabetes. NHS services to help change your lifestyle. If you have type 2 diabetes or have pre-diabetes and are at a risk of developing type 2 diabetes, you may be eligible for an NHS program that can help you. Speak to your doctor or nurse about the NHS medicine for type 2 diabetes. If you need medicine, you will usually be offered metformin, which is one of a few medicines used to treat type 2 diabetes. If you have another health problem or metformin alone does not lower your blood glucose level, you may need to take another medicine with metformin or change to a different diabetes medicine. If metformin or other diabetes medicines do not help, you may need to take insulin. It's usually used to treat type 1 diabetes, but it can be used to treat type 2 diabetes as well. You may need to take insulin a few times a day, either by injection or through a pump. This will help keep your blood glucose levels within a normal range. You will be told how much to take and when to take. Taking too much insulin can cause your blood glucose levels to grow too low. This is known as hypoglycemia or having a hypo. If you feel ill, such as vomiting, diarrhea, or very high temperature while you are taking diabetes medicine, speak to a doctor or a member of your healthcare team. They may tell you to stop taking your medicine temporarily until you feel better. Do not stop taking your medicine unless your healthcare unless your healthcare professional or doctor tells you to. Ask for an urgent GP appointment or get help from NHS 111 if you are taking diabetes medicine and having vomiting, diarrhea, or a very high temperature. You can call 111 or get help from 111 online. Appointments and tests. If you have type 2 diabetes, you will need checkups to make sure to make sure your treatment is working and your condition is being managed. These include checking your average blood glucose level, an HbA1c test every 3 to 6 months, a foot checkup once every 2 years if your last check was okay, or once a year if you need it. Checking your weight, body mass index, BMI, cholesterol, blood pressure if you need it. Checking your weight, body mass, you or your child aged 12 years and over. It will also be offered diabetic eye screening when you are diagnosed and reviewed every 1 or 2 years as part of the NHS diabetic retinotherapy screening program. Other changes you may need to make. Managing type 2 diabetes may also involve making other changes, such as wearing a medical ID wristband in case of emergency. Remembering to pack medicines in your hand luggage when you go on holiday so you have it with you. Getting a letter from your GP to take with you when you go on holiday. If you have health problems caused by type 2 diabetes or you get hypos, a drop in blood glucose level that can cause dizziness. You may need to contact the Driving and Vehicle Licensing Agency DVLA You can find out more at Diabetes UK, government.uk, Diabetes UK, Traveling with Diabetes, and Diabetes UK shop wrist band. Contraceptions, pregnancy, and type 2 diabetes. If you are thinking of having a baby and having type 2 diabetes, it's important to plan your pregnancy as soon as possible. This usually means asking to be referred to a preconception clinic if there is one available, or to a diabetes care team, to a diabetes care team. Changing your medicines to ones that are safe to take in pregnancy. If you have type 2 diabetes, talk to a doctor about the best contraception to use and how to take or use it. They may include the combined pill, progestin, progestogen only penile contraception inserted into the form. Complications. Long term complications of type 2 diabetes. Having type 2 diabetes increases your chance of getting other long term health problems, so it's important to get it treated and manage it well. Other health problems include damage to your blood vessels, which can cause coronary heart disease and stroke. Food problems such as ulcers and infections result in you needing surgery to remove your foot or leg and amputation. Sight problems such as diabetic retinopathy and blindness. Kidney problems, gum disease. You can lower your chances of complications by managing your blood glucose as well as you can, and by making healthy lifestyle changes such as eating a balanced diet, exercising, and not smoking. Important. It is important to go out to all of your diabetes appointments and make sure you do not miss any tests. Doing this can help find and treat any complications as soon as possible. See a GP or diabetes nurse if you have blisters or cracked skin on your feet. You have any pain, tingling or numbness in your body, problems, constipation or diarrhea, these could be signs of nerve damage. Your vision gets worse. Complications of high blood glucose. Although it's rare in type 2 diabetes, high blood glucose levels can cause a condition called hyper hyperosmolar state. This can happen. This can happen over a few weeks and is usually caused by an infection and being dehydrated. If you have high blood glucose levels, a lack of insulin can cause harmful substances called ketones to build up in the blood. This can cause a condition called diabetic ketoacidosis (DKA). Both HSS and DKA can life threatening. Can life threatening. Call 999 or go to A&E if you have type 2 diabetes and are being a lot, feel very thirsty, feel sick, nauseous, feel confused or very sleepy, feel drowsy, get short of breath. These could be signs of HHS or DKA, which can be life threatening if not treated quickly. Do not drive to A&E. Ask someone to drive you or call 999 and ask for an ambulance. Bring any medicines you take with you. Last, we have help and support. Help and support for type 2 diabetes. Support from charities and organizations. Diabetes UK. Information and support. Information and support for anyone with diabetes, including support groups, online communities, and courses and tools for managing diabetes. Website, helpline, email, all you have where you can contact. Social care and support. Our social care and support guide explains your options where you can get support if you need help with day to day living because of illness or or disability. Care for someone regularly because they are ill, disabled, or because of their age, including family members. Medicine for type 2 diabetes. If you need medicine, you will be usually be offered metformin, which is one of a few medicines used to treat type 2 diabetes. If you have another health problems, if you have another health problems or metformin alone does not lower your blood glucose level, you may need to take another medicine with metformin. You may need to take another medicine with metformin or change to a different diabetes medicine. If metformin or other diabetes medicine cannot cannot help, you may need to take insulin. It's usually used to treat type 1 diabetes, but it can use to treat type 2 diabetes as well. You may need to take insulin few times a day, either by injection or through a pump. This will help keep your body glucose levels within a normal range. You'll be told and how much to take and when to take it. Taking too much insulin can cause your blood glucose level to go too low. This is known as hypoglycemia or having a hypo. If you feel ill, such as vomiting, diarrhea, or very high temperature while very high temperature you are taking diabetes medicines, speak to a doctor or member of your healthcare team. They may tell you to stop taking your medicine temporarily until you feel better. Do not stop taking your medicine unless your healthcare professional or doctor tells you to. So this is all we have from this NHS type 2 diabetes. I hope you guys get the information that I wanted to give it to you. If you like the video, don't forget to press the like button. And again, I'm telling you, you have to contact your consultant, your doctor, or any healthcare team before using any of these medicines or treatments. So I'll be back with another videos with another books reviews or anything very useful for you. Till then, just take care and goodbye.